Everyone, we are back today with our this week's sorry. I just received a call and I seem to have disconnected it just a sec. Dr. Satija is going to join us, and I received her call, and there's something wrong with my. Yeah, just a sec. Yes, so I'll just connect with her and I'll find out where she is. So, this week is about success habits and challenges. And yeah, here she is. So I'll just invite her to join. Yes. Okay, so this is the fourth in our session. So why we thought of success habits and challenges? Because we've been talking a lot of our success. Hi Ruhi, thank you for joining in again. Fourth
Hi, Nupur.
session.
Yeah,
Wonderful.
thank you for having me. Always happy to be here.
Yes, it is. It is actually we've been talking about success a lot, and just prior to this call of ours, I was actually attending a very interesting session from NCW on this was about women entrepreneurs, and the spirit with which it was talking about women entrepreneurship, and uh, it kind of the and now coming to this session with success as what we are talking, and success habits and success challenges. I think let us kind of first do a quick, because we have still now spoken about what is the revised definition of success, relevance of success, and what is the language that we should be using. So just a quick
Yeah,
recap on what have we kind of discussed so far. So hearing from
sure.
you, how have what is it that we should be now looking at in the changed times.
Right. So, like we have discussed earlier as well, and today again I would address the same point. Essentially, that first of all, exactly the same point: survival. Right? Taking care of yourself, taking care of your loved ones, that is the most important priority right now. Nothing else matters as much. But definitely, you and I both understand everybody is not that privileged that they can only take care about this, and they have to take care about their survival as well, their finances, their, assets, everything is haywired, and the future is very, very, bleak right now. We don't know what's happening and how fast it is going to be better. Even that is a concern. So definitely, having smaller goals, having short-term goals is the right strategy to do that, because long-term we don't know what's happening, right? So at this point of time, if we can prioritize a few things that can be achieved in the next few months or maybe weeks, that would be better. But definitely, taking baby steps right now, because if you think of long-term and if you have bigger goals, it is going to be a bit overwhelming because of the
Right.
uncertain times and also the uncertain conditions, because definitely our goals do not just depend on our own efforts, right? The environment matters, the facilities matter, and right now the circumstances that we are seeing, a lot of things are not available as they used to be, right? So maybe, having some prioritized goals, short term ones which are actionable, would be a good strategy to go.
That's actually very helpful. Thank you, Vikas. I'm happy that you're very good and you're feeling good and that you're with us, and there are a lot of people who are joining us. So, जैसे कि we've realized and we've learned कि what matters right now is setting short-term goals and kind of
Yeah,
working towards them, rather than हम अपन जैसे पूछते हैं ना interviews में where do you see so yourself in 5 years from now,
5 years.
उसकी जगह ये
Yeah,
पूछे कि भैया what is it that you
yeah,
immediately want to live for. And I remember you kind of uh, saying be in the present moment, usko zyada
yeah,
dekho, usko zyada recognize karo. So that is very
yeah,
important. So there is something which also has been kind of on my mind for quite some time, that people who have lost loved ones or people who have
yeah,
had some kind of loss,
yeah,
उनके लिए what is it, क्योंकि उनके लिए ये टाइम सिर्फ एक sort of सिर्फ एक difficult time नहीं है. There's a lot of grief which has gone.
yeah,
They have to come out from that
yeah.
grief. सो पैंडेमिक खत्म हो गई,
definitely.
हम सब जानते हैं, मैं भी जानती हूँ, आप भी जानते हैं, बट देन दे हैव लेफ्ट. सो व्हाट डू दे डू, हाउ दे स्टार्ट अफ्रेश, बिकॉज सबको एक तरह से एक
Yeah,
नई बिगनिंग, एक नई शुरुआत करनी ही करनी है. सो
बिल्कुल
वो कैसे
बिल्कुल.
अपने आप को मैनेज करें?
Right. So a very big concern also, Nupur, this one. Kyunki, uh, to be honest, we all know somebody who has known somebody who is in hospital or, has passed away, unfortunately. So definitely it was a very difficult time for all of us. And that does not mean that the near future is going to be easy as well. Grief
Exactly.
is the main emotion that we all are facing right now. And it is not just grief, there is anticipatory grief as well. We are still very scared, right? We're still very, fearful of the unknown, of what's going to happen, and whatever has happened, how we are going to overcome that as well, right? So these are some of the points. So what I would suggest is, there is no easy way out of it. We have to give ourselves the time to overcome this. We have to give ourselves that, space to find the new normal, to be okay with what has happened. But then definitely I would really recommend, if you're not okay right now, there are so many helplines available, right? In fact, I'm working with two of them who are working free of cost for anyone and everybody who wants to call and just share what their concerns are. So definitely professional help is not the same as the one that your family and friends can give. Definitely the level of care is better with your family and friends, but the tips and the tricks that a professional can give, that's not the same. So I would really recommend that you take the help of these resources to overcome your issues, and they're all free of cost. Nobody is charging anything. We're all working so hard. We're all doing whatever we can possibly do, right, to get everyone out of this as soon as possible. So I would really suggest giving yourself the time, giving yourself that space, and taking as much help as possible, and also not putting yourself under pressure that you have to overcome this as soon as possible. It's not okay. Nothing of this is okay. We have to understand this. And the worst thing what happens is we call someone and आगे वाला क्या बोलता है, मेरे साथ भी ये हुआ था, मेरे साथ तो अरे तेरे साथ इतना हुआ था, मेरे साथ तो इतना हुआ था. That's the worst thing that we can do to anybody right
करेक्ट.
now. If someone has called you to share their pain, even if you are hurt, it is important that first you listen, राइट? वो बहुत गलत होता है कि हमें कोई फोन करता है कि यार मेरे साथ में ये हो गया, सामने वाला अरे ये तो कुछ भी नहीं है, मेरे साथ तो क्या क्या हुआ है. दैट्स दैट इज, एंड व्हाट दैट डज इज इट इवन कॉजेज मोर हर्ट कि यार मतलब अब मेरी पेन की वैल्यू ही नहीं है, right? So that is the worst thing you can do to anyone. So give them the time, give them the time. And then definitely I would again request ke professionals are available, and night time matlab mere paas, so how busy my schedule is, but still every
एब्सोल्युटली.
day I'm taking out time. We are taking free calls every day just to make sure everyone gets that line of thought कि यार कैसे इससे निकलना है. So yeah, do as much as possible for yourself. Take care of yourself first so that you are able to take care of others. I think that would be a good way to go right now.
बट इसमें एक सवाल जो मेरा था, जैसे आपने बोला ना, समटाइम्स पीपल डोंट नो, क्योंकि वो खुद भी इतना सा,
Yeah,
तो पीपल जस्ट वांट टू काइंड ऑफ ब्लर्ट इट आउट, ब्रिंग इट आउट, तो उसको अपने
yeah,
आप को कैसे रोके?
yeah. So blurting out, see, venting out is good. There's a difference in venting out and then sticking on the same point forever. है ना? क्या
हाँ.
होता है कि इनिशियल फ्यू डेज वेंट आउट करना बहुत जरूरी है. एंड नाउ वी कैन नॉट डिफाइन कि यार 5 दिन नॉर्मल है या 1 महीना नॉर्मल है या 1 साल नॉर्मल है. एवरीबडी प्रोसेसेस इमोशंस विद देयर ओन पेस, एंड दैट इज टोटली एक्सेप्टेबल. बट या इफ इट इज हैम्परिंग योर डेली लाइफ, अगर आपको ये लगता है कि आप एक पॉइंट पर स्टक हो गए हैं, आप मूव ऑन नहीं कर पा रहे हैं, आपकी डेली लाइफ इस वजह से इतनी इफेक्ट हो रही है कि आप फंक्शनल नहीं है, दैट्स द टाइम व्हेन यू शुड नो दैट ओके, अब मैं इस चीज से शायद खुद नहीं निकल पाऊंगा, आई माइट नीड समबडी. But if you are able to function, if you are able to take care of the things that you are supposed to, but being under grief, but being not that up to the mark, that's okay. That means that you will get over it soon enough. But yeah, venting out is very very important. I think that's the first step that anybody should take. जो suppress करते हैं वो ज्यादा hurt होते हैं. बोलना बहुत जरूरी है.
मैंने ना फिल्मों में देखा है, मुझे एक्चुअली इसका साइकोलॉजी नहीं पता, कि कुछ स्टेजेस ऑफ ग्रीफ भी होते हैं, कि जब कोई ग्रीफ
Yeah,
नहीं
yeah,
कर, तो वो
yeah, yeah,
उसका अगर सिंपली
definitely.
कुछ बता दो तो क्या
सो
होता
सी,
है?
सबसे पहले जब भी हमारे साथ कुछ भी बुरा होता है ना, हमारा फर्स्ट रिएक्शन क्या होता है? डिनायल, कि यार ये तो हो ही नहीं सकता. नाउ दैट कैन बी वेरी ब्रीफ इन फ्यू पीपल एंड वेरी लॉन्ग इन अदर्स, राइट? हम ये भी देखते हैं, नॉट जस्ट इन राइट नाउ, इफ यू सी रिलेशनशिप्स जब खत्म होते हैं, कुछ तो 2-3 दिन में ही ओवरकम करके ओके रीबाउंड चल रहा है या दे आर आउट पार्टिंग, एंड सम पीपल टेक इयर्स अलोंग टू कम आउट ऑफ इट कि यार मेरे साथ ये हो क्या गया, राइट?
करेक्ट
दैट्स द
करेक्ट।
फर्स्ट थिंग. देन उसके बाद क्या होता है, वी आर एंग्री that why did this happen to us, we are not able to accept it, right? Then the next stage that we have is the sadness, or the grief that comes, the depression that comes along with it, because certain level of acceptance तो आ जाता है कि अभी हो गया है क्या करें, but that does not mean that we are okay with it. So it starts from being angry के denial के हो ही नहीं सकता है, to getting aggressive about it, angry about it, to being hurt by it, but then accepting it to some level. And then, the stage comes where you try to come back to the reality, where you either try to find a way out or you're trying to create new ways to come out of this. So this is how everybody processes. And mind you, every stage will take different time in different person. और हम ये भी डिफाइन नहीं कर सकते कि यार इनका ग्रीफ कम है, इनका ज्यादा है. नो सच थिंग. वी आर ऑल वेरी कॉम्प्लिकेटेड पीपल एंड एवरीबडी इज वेरी वेरी डिफरेंट. दैट इज
And
द
that's
थिंग.
that's that's how it should be, that we should
इट शुड
recognize
बी.
कि एक ही
या
परिवार में अलग अलग लोग अलग अलग तरीके से उसको
रिएक्ट करते हैं.
प्रोसेस कर रहे होंगे एक
बिल्कुल.
एक स्टेज
So
को.
that is a problem also that comes. अभी in fact, very good point. Yesterday also only I was doing a therapy for one of my patients, and she said कि यार घर में एक death हुई है. She is the daughter-in-law of the family who was very attached to some like another person. तो बोल रही कि उनके खुद के बेटे को इतना नहीं इफेक्ट हो रहा, मुझे बहुत ज्यादा हो रहा है, right? And that is because she herself is undergoing through so much that it is not, it is not very easy to define, okay, this is right for you because you're the daughter-in-law, it should not affect you that much, the son should be more affected. That's a very
Correct.
very wrong way of seeing things. Everybody is different, everybody's mindset is different, and currently the stage of pain we are all in, everybody is different. So the baseline is very different for all of us. So there is no standard criteria कि यार इतना करोगे तो चलेगा, इससे ज्यादा नहीं होना चाहिए, right?
और
And the best
रिलेशनशिप तो
thing that
बिल्कुल
we
ही नहीं
can,
डिफाइन करती है
बिल्कुल
उसको.
भी नहीं. Definitely the emotions are never, we'll see somebody who loves their mother to death and somebody who can't sit with the mother. We have those extremes. Mother, why I
करेक्ट.
took the example, because that is the closest relationship anyone possibly has, right? But that is the truth of life. You cannot define based on that, right? So giving each other the respect and space to be able to express yourself, that is utmost important. क्योंकि अगर आप फिर expression ही block कर देते हो, then how is the person going to survive? तभी तो फिर ये सब problems आती हैं. Then you need somebody outside to help them because there is no one to listen to you, right?
And
Yeah.
that is why a person can go, and it's absolutely acceptable to take outside help. ये भी नहीं सोचना चाहिए कि मुझे
Absolutely,
जरूरत
it
नहीं है.
should be normalized. Yeah, that is the worst thing with the mental health care, I think. कि हम लोगों ने उसको इतना स्टिग्मा दे रखा है कि अगर साइकियाट्रिस्ट के पास जाए तो पता नहीं क्या हो जाएगा. I'm sitting in front of you, 5 foot girl, क्या हो जाएगा? You come to me and talk to me. उससे ज्यादा क्या हो जाएगा? That is really upsetting. People come to me years together of depression and 6 महीने बाद they are like हमें समझ में नहीं आ रहा हम सफर क्यों कर रहे थे. And for them it's a happy news. For me it's very upsetting. क्या जो चीज 6 महीने में ठीक हो सकती थी, you suffered for 10 years, 8 years for that. That's the worst thing that we do to ourselves. ना, normalizing the pain. हम हैप्पीनेस को नॉर्मलाइज नहीं करते हैं, हम हैप्पीनेस को ना अचीवमेंट से एसोसिएट करते हैं. दैट इफ समथिंग विल हैपन आई विल बी हैप्पी, बट बीइंग सैड इज नॉर्मलाइज्ड. कि या आई कैन बी सैड एवरी डे बट आई कांट बी हैप्पी एवरी डे. आई विल बी ओनली हैप्पी व्हेन आई अचीव समथिंग. व्हाट्स द लॉजिक, राइट?
See, I'm having difficulty to process it क्योंकि ना कहीं वो
या
प्रोसेसिंग में प्रॉब्लम है, बचपन से
ये
सिखाया
है.
नहीं है.
दिस इज व्हाट वी हैव बीन टॉट ना कि यार नॉर्मल तो वी आर इधर ओके और वी आर अपसेट. कुछ होगा तो वी विल सी यार कित खुशी की बात है या नहीं. नो, व्हाई डज द लाइफ हैज टू बी अ प्रोजेक्ट, right? Your
करेक्ट.
baseline should be happy. Okay, when something happens, you go down, right? But baseline should be on the happy level, ना? But then we have normalized this. Depression है, अरे बोलना मत, सोसाइटी क्या बोलेगी? सोसाइटी ने तुमको आगे क्या करना है? That is the stupidest thing, इतना ज्यादा. मतलब I don't even find any rational in discussing these things because they are just unnecessary discussions. It should be point blank. यार नहीं हुआ है, जाना है. That's it. What is the need to discuss?
Just like a
अभी
pain or a
कोविड
what, तो
है.
डॉक्टर के पास
Yes,
जाना है तो जाना है. कीजिए.
exactly. If you have a symptom, you go, right? Fever है, जाना है. गला खराब है, जाना है. तो डिप्रेशन है तो क्यों नहीं जाना है? मतलब what is the need for me to sit for 1 hour and give you a lecture on that or write
Absolutely.
articles about it? This
Correct,
should be
correct.
common sense, right? And
Common
by
sense.
now at least the new generation that is so aware and educated, अगर उसको भी ये चीज समझानी पड़ रही है, 100 चीजें हम करते हैं जो सोसाइटी को एक्सेप्टेबल नहीं है. वी आर ड्रिंकिंग इन द पार्टीज, वी आर गोइंग टू क्लब्स इन द मिडल ऑफ द नाइट. दैट इज एक्सेप्टेबल बाय सोसाइटी नाउ. दवाई लेना नहीं है. What's the point? And then we see so
True.
many worst case scenarios happening. I get patients with suicidality, I get patients with suffering. So unnecessary. ये है.
उतना
So
एक्सट्रीम
मतलब
तक
if
नहीं ले
there
जाने का जरूरत है. You can
नहीं जाने
actually.
का.
हाँ.
That's it.
Correct.
And now to see it's so easy na. Earlier to it used to be कि you have to walk into the office. Now because of the online thing, now to it's so easy. You just take a consultation sitting on your phone. Nobody even needs to know who you're talking to and you are done. Right? Why do you have to torture yourself? But why have we create these misconceptions in our head and then we live by them?
Yeah, there's a question here which is
Yeah.
asking how to overcome relationship breakup.
Yeah, go to a professional. That's how you overcome. If you're not able to do it yourself, there is no one answer to it. Give it some time, right? See other things. Where you can start is that you start doing little things that that make you happy every day. So you keep yourself a bit busy, you keep yourself a bit occupied. See yourself who you are if you're not in the relationship. What happens is when we have a serious relationship, we try identifying with it so much that we forget who we are if the relationship is not there,
Wow.
or what our life will be if the person is not there. And that is the problem. The problem is that the relationship broke up. The problem is we don't know what to do now, right? So find yourself, look for what you love, what else is there that you can possibly do. Start from there, and then of course, ask help of a professional and vent it out. Seek help. See what is it that's bothering you so much. See what is it that's keeping you stuck there. Sometimes we have our self-worth issues. Sometimes we have the dependency issues. जिसकी वजह से it's not very easy to overcome somebody with whom we have been, attached for such a long time. So working on that will really help.
That's actually very helpful कि हम लोग जब relationship में होता है तो we kind of in any relationship, so even
Yeah.
when a mother and son and a parent children kind of
Yes.
relationship, we kind of feel difficult when there is a movement apart because पूरा जिंदगी वही वो हो जाता है
Yeah.
उसी के
Yeah.
अराउंड.
We don't know who we are, ना. अगर वो
Correct.
relationship नहीं है तो हम हैं कौन? That is the problem. So if
And
we
that
are
is
in a
how
new
we'll be
now, if
defining
it
ourselves.
yeah, that's
Correct.
exactly the point, that we define ourselves with that. So the
हाँ.
definition needs to change. The day you'll change the definition, you're over that relationship.
That's very helpful. I hope that helped,
Yeah.
Peter. Um,
Yeah.
okay, my next question, I think, and we partly discussed is how can families, like we're living in a community system right now, so it's
Yeah.
not just individuals. So we've said that there are families and there are communities, there are offices, office environment. Everyone
Yeah.
needs to come out of it together. So how
Yeah.
can we facilitate that everyone coming out of it together? And even though you've mentioned some point, be a better listener,
Yeah.
give people space, give people their own conditioning to kind of. But what else can be done if at all?
Right. So the first thing is that we need to understand that we want to do it together, but we might not be doing it at the same time. Like we discussed, that everybody's processing system is very different. So we have to give each other that space that, today if you are not okay, it's okay. I'll be there. Help you overcome this, but definitely I can give you the time to overcome that, right? That is the most important thing. And then what we need to understand is that it is happening to everyone. So as much empathy we are expecting from somebody else, we should be able to give somebody as well, right? You need to give what you expect the other person to give you. So this is something that we have to talk about, that we give each other the space and time to do it, and more importantly, the strategies if possible. Again, like I talked, that the stigma is there. So if you know somebody who can help the person, go ahead, refer them to someone who can help you. That's something that we can do. And again, this together should be there, but yes, it has to be now. That criteria should be out of the window.
There are questions about porn addiction here. Then what we'll do
Okay.
is, do you want to take something a
Another
quick?
session.
Yeah, we
No,
can
no.
do another
This is
session.
a clinical diagnosis. What you need to do is, if it is severe, go to a professional. CBT therapy helps. Cognitive behavioral therapy works really well with addictions. You can go there, and definitely, you need to go to the root of it. That why you get addicted in the first place. It does not matter if it is a porn addiction or a drug addiction. An addiction is an addiction. The process is similar. So, going to a professional, go to a psychiatrist, and get evaluated. That will help.
That actually is helpful. I think what we can do, the is we can probably also bring up another session on this, but right now,
Yeah,
हाँ, because ये
it's
बहुत ही
beyond the
फील्ड है,
scope.
बहुत ही specific है,
Yeah.
and lot can be discussed about it as to why, and like you said,
Why it
uh,
happens. Yes, yes, that
why
is
it
the most
happens.
important that we need to focus on, that why it happened in the first place. If we know that, then we can overcome it.
And thank you for bringing this up. Again,
Yeah.
Peter, you said mera focus studies after breakup. That is where Dr. Ruhi said that, probably, Peter, you have to understand what is it that you need to kind of how you are seeing yourself in terms of studies, in terms of after relationship. What is your goal?
Yeah.
Maybe not long term. That is what we said in the beginning of the session. That is what Dr. Ruhi said. Maybe make short term goals for yourself in terms of studies. I think that will
And
help.
when you're already upset, why do you want to study? Nobody wants to study. Anyways, when we're happy, we don't want to do it. When you're sad, why do you want to do it? Focus on something that makes you happy first. Get into that state of mind that you can take on something that is difficult or challenging. Studies are one of that you need to focus on it, that you need to use your mind. So first do something to make yourself feel better, and then you can focus on that.
Someone has said it's sad how companies and colleges don't consider depression and anxiety as an illness.
Yeah. Yeah, Shruti,
Yes,
absolutely
Shruti.
right. So it needs to start with people like you who are aware and who know, there is always a torchbearer for everything. So now that you are somebody who recognizes it, maybe you can be somebody who, promotes it for other people. One person, even if takes the initiative, they can educate at least 10 people, and that's how we change the world, right? So that's a very good question. Yes, people don't recognize, but that, the last generation anyways had problems. We don't, so maybe we can do something about it.
And I think this pandemic, it has become a question which is being discussed largely. There are
Yeah,
people who are discussing it. Unlike, like you in the first session, in the first success session, you actually mentioned it very well that this is the first time around we are talking about mental health. We are talking
yeah.
about, it was never ever, there have been pandemics before, but mental health hasn't actually been given the kind of
Attention.
attention that it should have been. So yes, it's not
Yeah,
that things haven't started changing. It's just that they're so gradual that we kind of are now, and we are having these discussions. So you're joining in, and that is what will bring about the change. So we are kind of
yeah,
hopeful now.
yeah,
Um, I think what towards it's almost the answer towards the last question that I have is there'll always be patterns. There are always patterns that one kind of falls in when they're looking at. So what are the red flags? Because why I want it in terms of success habits is when they are kind of going towards a new habit or a new beginning kind of a thing. Sometimes
yeah.
when they're coming out of grief, they might fall back into their own thinking process. What are the red
Right.
flags that they should be looking at, so that कि नहीं ये pattern में नहीं जाना, ये thought process में नहीं जाने का है.
Okay. So pertaining to success, when we are talking about, there are a few habits which are, they might not ensure that you are going to succeed, but it makes it highly likely that you will. Right? So resilience is there. Making a schedule, having a plan, following it, being consistent. These are some of the things that are happening. So when you're trying to start afresh, when you're starting to, come out of it, like in the relationship thing also, stated this, start with one thing that you are okay with doing. It not necessarily be directly related to your goal or the success that you're expecting. It should be something that is easy to do for you. To be honest, in therapy sessions, I give as simple as just get up and have a glass of water. That itself brings the momentum that, okay, one thing, now next what? right? So having this continuity, having something that can give you a little motivation will bring you out of this phase, and then tracking it, that okay, 5 days I did, then 2 days I didn't do. If you can recognize what was it that stopped you, what was the resistance, what was the hesitation on that day, then we can find out that okay, this bothers me. So for example, some people will be like, okay, if this happens at my home, I'm not able to focus, right? Relationship issue, if this is not there, I'm not able to focus, right? Otherwise, again, having unrealistic goals is one of the biggest red flag. We want to achieve something, but the goal is so big or so unrealistic that I'm not saying you can't achieve it, but then you have to have some plausible explanation of what it is, right? For example, someone will say, okay, very simple, common goal. I want to be an actor. All right. 5 years, I want to be Shah Rukh Khan. All right. What are you doing about it? Nothing. I'm watching Instagram, I'm watching YouTube, I'm passing my time making my body, and I want to be an actor. Right? So, what happens is our goals, first of all, need to be measurable. They can be as unrealistic as possible, but with a concrete plan and achievable measurements. That okay, if I want to be an actor, let's say, what does that mean? I act. How do you define it? Okay, in the next 2 months, I should do one project. That's how you do it. But then
Correct.
the expectation is that I'll directly become Shah Rukh Khan. That doesn't happen. That's why most of the people fail, because everybody wants to do big in life. There is nobody who will get up and say that I know I'm okay with my middle class life or mediocre life. Nobody wants that. Everybody starts with becoming a millionaire or billionaire only. But the problem is that they know what they want, but what is the path to it, they're never able to create.
They
The
haven't
path
seen Shah
has
Rukh
to
Khan
be
in
clear.
Padika Bazaar.
Exactly, exactly. That doesn't register to them. And how much he works? How much does he work? He wakes up at 4 a.m., he's working till 12 in the night. Do it. Do it, and then you'll
Correct.
be there. So basically, the goal can be as big as you want, but it has to be unrealistic in the sense that it has to be measurable. I'm not saying you can't have larger than life goals. Everyone must have one. I have to. But then there are steps that I take for it every day. If not
Correct.
every day, at least 5 times a week. So, and you should know those steps. You should be able to measure those steps. You should be able to track those steps. That okay, tick mark. I read that one chapter that I need for that degree. I read that one vlog or podcast that I was supposed to see. I read that book that I was supposed to do. I took part in some competition. I took part in some workshop that I was supposed to do. Something that you can in evening tell yourself that okay, see, this is what I did and it is directly related to my goal. When you're not doing that, it's a red flag in a big way, because you didn't put any effort. And mind you, even one day of stopping, or it's okay if you were not able to do anything today, but at least having that focus that okay, I missed one day, and having that little bit of pinch in your heart that I wasted one day. If you have that type of a mindset, you'll go really fast.
Absolutely. I mean, that makes a lot of sense. Keep your goals, everyday goals, and then work towards
Yeah.
it. Yeah,
Yeah, it should be
that's very.
measurable. It shouldn't be I'll read a book. It should be okay, 10 pages today. Then you know whether you did it or not, right?
I think Peter, that answers your question as well. कि आप अपने को focused ऐसे भी रख सकते हैं that when you're trying to study for examination, you don't have to try for something big. You can try for something very very simple and very very maybe 1 page a day or maybe 2 pages a
Yeah.
day, and then you can probably give yourself a start with that instead of
Yeah.
trying for last minute या फिर जिस तरह भी however you kind of plan it. So whatever that
Yeah.
is what might help you, and it will
Yeah.
be difficult, so be ready for that, I guess. Some people might say
Yeah.
because there are a lot of emotions going on in the mind, so it might be difficult, but still a pat in the back after a tick definitely should be given कि आपने कर लिया वो tick लग गया. You should always appreciate
Yeah.
yourself for that tick.
Yeah.
Yeah, so
They
we
say na,
almost
if
at.
it was easy, everybody would do it. If it was
Absolutely.
easy, everybody would do it, right?
Yes, and
So we
you
need to
are
keep
doing
that
it
in mind.
now. You were not doing in the past. You have come that long way of doing it
Yeah.
now. Yes, that
Yeah.
itself means that you've taken one step ahead.
True.
Wow.
True.
So that was a very helpful discussion. Thank you so much. We'll be coming back to us on again. I think in June, first week with our final round of success discussion, and from there on we'll follow up with more. There were couple of suggestions and I'll discuss with Dr. Ruhi as to whether and how we can probably bring that up, if at
Okay.
all, right?
Yeah, yeah,
And
definitely.
and so much everyone for joining in. It was, and thank you for your questions because it kind of enriched the discussion today.
Yeah, yeah,
So
definitely.
thank you so much, and thank you, Dr. Rui, for joining in.
You're
And
welcome,
again,
Nupur. Always
and
happy
all
to
the
be here.
people, yeah, thank you so much.
Take care. Bye.
Bye bye.